system, it was agreed that information particularly important to those who generally participate and attend our Generations Expo is more important than ever. Today I'm excited to introduce speakers that will share important information on sepsis, joint health, urological issues, hearing, stroke prevention, and regenerative surgical options. Before we begin, I want to thank our presenting sponsor, Northeast Georgia Health Systems, as well as our supporting sponsors and preferred vendors, including Denison Hearing Solutions, Royal Blue Medical, Fernbank Museum of Natural History, the City of Lawrenceville, Gwinnett County Communications, Advanced Urology, Aurora Theater, Belk Mall of Georgia, the Gwinnett Stripers, and Levin Florist. If you joined us last week, welcome back. If you missed last week's event, you can view it on generationsexpo.com. We're doing this event a little differently, you'll notice. If you have questions that you would like answered regarding any of the speakers' presentations or other issues of concern, please feel free to post them during the presentation. We will make sure that you receive answers either live or if more detail is needed after the event. You can also view this event in its entirety or watch parts that are of particular interest to you starting tomorrow on GwinnettDailyPost.com and for the next few months on GenerationsExpo.com. Now I'd like to introduce this week's keynote speaker, Carol Ann Gelderman, RN and manager of the sepsis program at Northeast Georgia Medical Center. Carol Ann will discuss the importance of sepsis, your risk factors of developing sepsis, and the connection between sepsis and COVID. You will hear how Carol Ann's journey began close to home when sepsis claimed the life of a close loved one. Please welcome Carol Ann.
Good afternoon. I'm Carol Ann Gelderman. I'm the nurse manager for the sepsis program at Northeast Georgia Medical Center. So excited to be here today with you to share some information about sepsis and our sepsis program at Northeast Georgia. First of all, I'd like to begin by just telling a little bit about my story. Actually, it's my daughter's story, so that you can get a context into why I do what I do at Northeast Georgia and why it's so important for me to be talking to you today. 7 years ago, my 20-year-old daughter did get sick and was hospitalized. She was recovering in the hospital and acquired an infection which was not recognized in a timely manner. Unfortunately, we lost my daughter to sepsis. And so when I come to work every day, I'm thinking about my daughter and thinking about other families that have been affected by sepsis, and really do this so that others don't have to go through the same thing that my family went through. She was a nursing student at UNG, and so I often think about her working side by side with me, but didn't get that chance. And so I want to make sure that for our community we have everyone having the chance at their life the way they should. I want to just open it up with some kind of common myths that we hear about sepsis, and I get asked all the time, what infection causes sepsis? And so right from the beginning, sepsis is the way the body responds to an infection, and it could be any infection. It could be a common infection like a urinary tract infection that we often hear about. It could be pneumonia. It could be the flu. And more recently, it could even be caused by our infection COVID that we've been dealing with over the last couple of months. Some more uncommon infections we don't think about, like parasitic or fungal infections, can also cause sepsis. Infection can cause sepsis. It's really the body's response to that infection, and we like to think of it as an over-response. The body over-responds, causing damage to our organs, and then our organs begin shutting down, and that's really what causes mortality or death in sepsis cases. But even before then, there are a lot of clues and signs that our body is over-responding. Some things that we commonly look for is an increase in heart rate. So you just feel like your heart is racing, and it normally doesn't feel that way, and you have no other medical condition that would cause it to do that. You might get lightheaded when you stand up, and that's often caused by a decrease in our blood pressure. We don't often have a blood pressure monitor at home, but if you stand up and you're getting a little lightheaded and then it passes quickly, it's often because we have a low blood pressure. In terms of our kidneys, which help filter toxins out of our body, if we have less, aren't going to the bathroom as much as we normally do, that's another sign of infection is being responded to with an over response. When we think about, and this might not be something that we as individuals, if we're having the infection, but a lot of times our family members will indicate, something just didn't seem right. They just didn't seem as with it as they used to. They were very confused, and so that is another sign that our body is over responding. All of these signs that I'm talking about are related to different organs in our body. So the confusion is related to our brain function. Our blood pressure and heart rate is related to our heart. Decreased urinary output is related to our kidneys. So all of these are causes of concern when we're fighting an infection. Now, many times our body fights an infection very well. Our body's designed to fight infections. We often see an increase in our temperature, especially with flu. With our older population, we often see the temperature go down. So instead of it rising, it will go down. But all of those are in response to our body trying to fight an infection. We often see some lab results that tell us an infection is occurring. We see white blood cell count increased, but that's not something as an individual we're sitting at home that we're actually going to be able to see. So we're really looking for those other signs and symptoms of sepsis like confusion. Urinary output is not as much. We're not going to the bathroom as much even though we're drinking the same amount. We might feel chilled. So normally, our temperature is normal, and when we get a temperature, we get a low temperature, we may feel chilled. So sometimes the way we felt when maybe we've had a case of the flu in the past. Those are all early signs of infection and that our body is fighting an infection. When we really see it affect our organs is when we get concerned about sepsis. And that can happen very quickly in some cases. So that's why it's so important to seek medical treatment when you have an infection and it's not getting better, or you're starting to see these signs like the confusion I mentioned earlier, or not going to the bathroom as much. All of those are signs that the infection is not, our body's not able to fight correctly and maybe over fighting that infection. And those are signs that we need to go ahead and seek medical care. Even if we have already gone to a doctor, even if we're maybe on treatment for an infection, if it's not getting better within a few days, then we need to seek that medical care because perhaps we're not on the right medication for that particular infection. And so we don't want to take the chance that sepsis can develop. Our body's very good at compensating, so even when we're fighting an infection or even when there's something wrong in our body able to adapt very well. That's how we're designed as humans. The point where it no longer can compensate for any of the deficiencies or any of the infections they're fighting is when we see people go into shock, what we call shock. And when that develops, it's very difficult to save someone's life when it's caused by an infection or caused by other reasons like heart disease or something like that. But that's really, that time frame where we're okay to where we're not okay is almost like a switch. And so it's just hours after having that happen that we could be in real trouble. That's the importance of seeking treatment early. A lot of people don't really know, I'm at home and I'm sitting here and I'm not feeling well. I've been fighting an infection. I'm just not sure. If you're questioning it in your mind, I will say the rule of thumb is that if you're asking the question, then you probably need to seek medical care. And if you have some of those later signs that we talked about, like confusion or decreased urinary output, probably a trip to the ED is going to be where you need to go. We do have a handout that we hand out for our outpatient patients that are have an infection, but they're doing fairly well and we're going to be managed on an outpatient basis at their home. Then we do have a handout that kind of talks about signs and symptoms and when you should go to the hospital, when you should go to the ED, when you should seek just a call to your physician. And so that is very helpful when trying to make that decision of if you need to go or not. Another common question I get is about risk factors. Well, what's a risk factor for sepsis? And I do want to start out by saying anyone can get sepsis. It doesn't matter what age you are. It doesn't matter if you have comorbidities or not. But there are some populations of individuals that are at highest risk to develop sepsis when they're fighting an infection. The first one being if you've had sepsis in the past, your body may never be able to get back to its baseline in fighting infection, so you're more prone to develop sepsis in the future. And then kind of the common risk factors are age. So very young age, babies that haven't developed an immune system yet are very at risk. And then our older population that begin to have their immune system decline, which is just a normal part of aging. So both of those are, at risk of developing sepsis more than other individuals. Another thing is people that have comorbidities that affect their immune system. So those things could be diabetes, it could be COPD or lung disease, it could be heart disease. All of those comorbidities and diseases that you might have that you deal with on a daily basis will also put you at risk for developing sepsis. If you're on any kind of immunosuppressant, so if you take medication that would suppress your immune system and makes your body less able to fight infections, so a lot of times we think about our transplant patients. So if you've had a transplant and you're on medication for that. Also, some of our autoimmune disorders, the medications that we use for those will cause our immune system not to respond as well. So all of those are risk factors for developing sepsis. But again, anyone can develop sepsis. Those are just people that are at the highest risk. Do want to talk a little bit about treatment, because people often say, well, how do we treat sepsis? And we're not really treating sepsis. We're treating some of the signs that are caused by sepsis, but we're also treating the infection itself. So it depends on what the infection is. If it's a pneumonia, then we're going to treat with antibiotics. If it's the flu, then we might be giving the antiviral medications that we get with flu. If it's a fungal infection, we might treat with antifungals. So all of those medications will help control the infection. Another way we control infection is if we need to do surgical some kind of surgical procedure. For instance, if we have a skin or a wound that's not healing, sometimes they will need to go in and clean out that infection from the wound. A lot of times our abdominal cavities, if we develop some sepsis because of an abdominal, we have a perforation or a cut in our lining in our abdominal cavity, that can cause sepsis as well, so that would require surgery. Appendix, you've heard people talk about appendix burst, so that's a great example of where we'd have to do a surgical intervention and go ahead and take the source away from whatever is causing that infection. We often do fluids as well, because we mentioned that our organs are affected and they start shutting down, and the reason they do that is they're not getting the oxygen and nutrients they require to function. In order to be able to increase that, we give fluids so that our body has enough volume to get all of that nutrients and oxygen to the organs that are needing it, like the kidneys, like our heart, like our brain. And so fluids are often given as well. And if we're in shock and we're having trouble maintaining our blood pressure, then there are some medications called pressors that help us to keep the heart in function and keep that blood pressure up, so that we can continue to supply our other organs with the volume that they need and the oxygen that they need. So all of those are common, treatments for sepsis. But again, it's just thinking about what is causing the sepsis, what infection, and then determining what the treatment is for that. In addition, we do fluids. In addition, we can use medications to help with blood pressure if the blood pressure is not maintaining on its own. So those are all things that we would do to take care of sepsis. Now at home, probably rule of thumb is to really, if you're fighting an infection, to continue to take in as many fluids as you can to prevent that dehydration and prevent that volume from decreasing to those vital organs. Your medications, like your antibiotics that you're prescribed, using them fully as prescribed all the way to the end, even if you feel better, is very important. And that's really important for the development of what we call these superbugs, or these resistant bacteria that are hard to treat. By taking them the full course, that helps really minimize that. So that's really what we're looking at when we're talking about treatment. If you're being treated for sepsis in the hospital, oftentimes you'll end up in a critical care unit because of the seriousness of how quickly someone can, get worse or deteriorate. So often you'll see people in a critical care unit. So I didn't want you to be scared by that if you happen to have an infection and you're admitted to the hospital. A lot of times people talk about, the different things they can see. So talking about wounds especially, because not only are you really listening to this for yourself, but you're listening to it for your family members, and I hope that you would pass on this information. But skin or wounds probably are our main concern of infections with younger adults, so kids, grandchildren. And then for older adults, often it's something to do with the lung or the urinary tract. So oftentimes UTIs and pneumonia are our biggest infections that we're dealing with as older adults. So to keep kind of those things in mind and just doing daily precautions for those. So making sure that we are taking in enough fluids on a daily basis so that we don't get dehydrated, that all of our organs are functioning correctly, can just help us stay healthy altogether. Welcome back. Wanted to continue our talk today by probably talking about what all of you are thinking about and we hear so many questions about in the last few months, and that is the relationship between sepsis and COVID. Many of the individuals that have COVID and get very, very sick with COVID really are struggling with sepsis because COVID is a viral infection, and generally we don't have as many cases of viral infections getting to the point of sepsis as we do kind of our bacterial infections, but COVID has really changed the look of that over this past year or past couple of months. So it is a viral infection, and someone's body may respond by kind of this super or hyper-inflammatory response, which is what we see with sepsis all the time. And that's generally, we're seeing that in COVID a little more pronounced than we're used to seeing in other viral infections. So it is, we're studying it now. We're looking to see what we can learn about it. But I did kind of want to talk a little bit about when an individual does have COVID and the infection causes their body to over-respond and it eventually might take their life, that really they are dying with sepsis. And it's not something separate. It's just another infection that can cause sepsis. Treatment for COVID is a little bit different though, because it really involves our lungs. We don't want to overflood our lungs with a lot of fluid, so we're much more conservative on fluid intake with our COVID cases versus another typical sepsis case. So that's kind of a difference there. And often when we have a viral infection like COVID or the flu is a kind of a similar situation, we can develop a bacterial infection on top of that if we're hospitalized for a period of time. So we're really watching for that if you're hospitalized with COVID to make sure you don't develop a secondary infection that we need to treat with, say, antibiotics. So that's really, kind of a warning for us as to a long hospitalization. Is there a possibility that another infection has developed that we need to treat a little bit differently? A lot of people, we hear a lot in the news. We're hearing it a lot across, community members about, they're not really dying. They're dying of something else, but because they were COVID positive, they're being coded to, reflect COVID, and then our numbers looked increased. And really what I'm seeing is, in at least our hospital system, that truly they are having a hyper response to the infection, which is causing their organs to not function, and that is ultimately causing the death. We see a lot more blood clots, which is another sign that you can have in later stages of sepsis, where our blood is clotting differently than it normally would. And so blood clots, we're seeing that a lot more in COVID than we see in other viral infections. So again, it's very early. We're gathering data. We're learning all we can about how to treat COVID. It's changing weekly, even daily, but I think we're getting a better handle on it as time goes on, and hopefully we'll be in a better position a year from now when we meet again for the next year's Expo. I would just like to really finish up by really talking to you about being an advocate for yourself. A lot of people, when we go around to health fairs and when I do community lectures, I always poll the audience and poll the participants and ask them, do you know what sepsis is? And I'd say 50%, it's about 50% in this area, do not even know what the word is. And another probably 25% say, I've heard of that, but I'm not really sure. Isn't that like a urinary tract infection or a pneumonia? And so we really don't, as a community, have all the information that we need. So it's very beneficial to be your own advocate. When you're having an infection and you have to come into the healthcare system, actually saying those words, could this be sepsis, will really attune the healthcare team to say, okay, there's an infection, we need to really be thinking about preventing sepsis in this case. And so just advocate for yourself and your family members to ask that question. Healthcare providers know what we're talking about oftentimes, but we don't speak the language. So we aren't often using the word sepsis when we're talking to patients. And so it really leaves everyone kind of in the dark. And so by you bringing it up and advocating and asking about sepsis and talking to family members and other community members about sepsis, I think it will help with sepsis awareness across the board. It would be lovely if in a year or two from now, when we were meeting at an expo, that our numbers were somewhere around 90% of the community knew about sepsis, because the biggest thing is coming into the hospital in a timely manner. And so if you don't know about it, there's no way for you to know to come in and get treatment. And it's so vital to saving lives. And then the last thing I wanted to talk about is just a little bit about what we're doing at Northeast Georgia, so that if you're admitted to the hospital and are diagnosed with an infection, you'll kind of know what we're doing on the back side. We have a whole team that is monitoring at the same time as you're being treated, monitoring all your signs and symptoms using a kind of a machine learning algorithm to identify your risk. So it takes into account your age, takes into account your comorbidities, takes into account your vitals, your lab work that's coming back, and it's updating every 15 minutes in the computer. So if it goes up, we'll get notice of that, and then we'll look at your case, and we'll work with the primary care team to make sure that you're getting treatment very fast to prevent deterioration, further deterioration. And that's really for us to move from reacting to infections and sepsis and to a point where we're preventing sepsis from ever occurring. So then we really are only treating infections instead of sepsis. So that's happening 24/7. We have nurse navigators that are looking at all of the patients that are coming in the door of our hospitals or are admitted to our hospitals as well. I really appreciate you guys letting me talk to you today. I'm happy to entertain any questions that I might have brought up or something I might have forgotten. You can reach us at sepsis@nghs.com at any time, and we'll be sure to respond and try to answer your questions. Thank you.
Thank you, Carol Ann. I'd like to take a minute to thank the folks making today's presentations possible, including our presenting sponsor, Northeast Georgia Health System, as well as our supporting sponsors and preferred vendors, including Denison Hearing Solutions, Royal Blue Medical, Fernbank Museum of Natural History, the City of Lawrenceville, Gwinnett County Communications, Advanced Urology, Aurora Theater, Belk Mall of Georgia, the Gwinnett Stripers, and Love and Florist. Before our next presentation, please watch this message from one of our supporting sponsors.
Get ready to discover a world of wow at Fernbank. Spend a day filled with things to see, things to do, and things you won't believe. Experience nature's thrill ride. Journey to the third dimension. And feel the excitement in your bones. Fernbank, Atlanta's science and nature experience.
Welcome back to Generations Expo virtual event presented by Northeast Georgia Health System. Just a reminder for those of you who are watching. If you have questions or would like additional information on the topics discussed, you can post your request, or you could also email events@scompapers.com. Now I'd like to share a message from Aileen Jackson, Northeast Georgia Health System Joint Care Specialist.
My name is Aileen Jackson. I am the orthopedic nurse navigator at Northeast Georgia Medical Center in Brazelton. I've generally been in the surgical field on the surgical units and mostly in orthopedics and then a little bit in general surgery as well. My biggest part is being a reference point and a touch point for patients through the whole joint replacement process, from beginning prior to surgery when I start with education and letting them know what's going to be happening, the whole process of how to prepare for surgery while they're in the hospital, and then when they go home as well in order to be successful. I serve as their guide, their familiar face coming into the room to check on them, the person on the other end of the phone. If they have questions or concerns, they can reach out to me. I think Northeast Georgia Medical Center is special because of all the different services we have, the wonderful physicians, the staff, and just the extreme support for the community, being there for what our community needs and helping them to stay healthy and making a good impact on the area. I love that I get to do both of my favorite things. I get to still see the patients, work with them, but I love to educate them as well. It's the best of both worlds. I still get to be part of patient care, but then I get to be their teacher as well. When you see somebody have a joint replacement, you see them from beginning to end when they come in and they're struggling, and then afterwards when they leave, and I get to follow up with them and see how much difference the surgery has made and how they're able to live their life and not have any limitations.
Thanks, Aileen. Now please welcome our next guest and Georgia native, Dr. Neil Patel, urologist and surgeon from Advanced Urology.
My name is Dr. Neil Patel, and I'm a urologist, chief technology officer, and director of robotic surgery at Advanced Urology. I was born and raised here in Georgia. I grew up in a town called Monroe, Georgia, and grew up and went to school in Athens, Georgia. Once I finished high school, I went to Chicago for undergrad and medical school. I went to New Jersey for residency training in urologic surgery, and then I went to University of Southern California in Los Angeles to learn advanced robotic surgery, oncology, and laparoscopic surgery. And what I realized the most after being all over the country, whether it's Chicago, New York, or LA, is that there's no place like home. And that's why 3 years ago I decided to come back to my hometown and provide care back to the community that I was raised in. What brought me to Advanced Urology was the fact that I wanted to be close to home, and I found that this practice, out of all the other practices that I've experienced or looked at in the country, was the practice that provided the best quality care to patients. They provided a good experience, and they used the latest advances in urologic technology to provide the best possible outcome. Many people may ask what urologists do. Well, we take care of the daily ability to be able to pee. You'd be surprised how comfortable people get with being able to urinate every day, and then one day they can't, and that's a big problem. And so we specialize in bringing good quality of life back, because you'd be surprised how much your bladder has a control over your life. But not only that, we take care of bladder leakage. A lot of men and women as they get older think that leakage is just a normal part of aging, and it is not. We also take care of all types of urologic cancers, which include prostate cancer, kidney cancer, bladder cancer, and testicular cancer. It is very important to make sure that you get screened by your primary care physician or see a urologist on a yearly basis to make sure that you don't have any of the signs of these types of cancers. More importantly, September is Prostate Cancer Awareness Month, so make sure you talk to your primary care physician or see a urologist and ask to be screened for prostate cancer. Most of the urologic issues are affecting your quality of life. If it's not peeing, it could be erections, it could be sex drive. There's a lot of things that we are embarrassed to talk about with our friends, family, and our primary care doctors that is normal to talk to about with a urologist. So don't ever feel like whatever you're experiencing is a normal part of aging, because we can always do many different things. What sets advanced urology apart from other practices is that we put patient experience first. I believe that when you come to see a urologist, you're almost always dealing with a very sensitive issue, and you need someone who understands the nuances of those issues. We employ the most latest advances in technology and diagnostic workup to make sure that we fully understand the process, and we spend a lot of time educating you on the disease processes, from drawing on the board to personal phone calls to follow up with your entire care team, whether it's your primary care doctor or your referring doctor. We try and bring everyone together as part of the team so that you can get the best possible outcome for yourself and to get back to a sense of normalcy in your life. What you can expect when you arrive at Advanced Urology, the first thing you'll notice is that our front desks are open. We do not have glass or barriers between you and our staff. You will always see a smiling face greeting you when you walk through the door, and they will be there to make sure that your experience is as great as it can possibly be. I believe that the number one thing that we can do for you is to show you a smiling face when you walk through the front door, because that's usually half the battle. The main services that are offered by Advanced Urology include not only top-notch physician care, we have every fellowship trained specialty within our practice, so almost all cases, whether they are simple or complex, are treated within our network of physicians, surgery centers, and hospitals. We offer the latest and greatest in technology, which includes micro-ultrasound 3D fusion prostate biopsies for patients who may have an elevated PSA and are concerned about prostate cancer, to our own Da Vinci robot, where we can do outpatient robotic surgery at our surgery centers. This allows us to provide better outcomes at a better value at a lower cost to the patient. And with those technologies, it's just naming just a few of the things that we do that will help provide better outcomes for the patients. At Advanced Urology, we are up to date with all the latest technology. We are the only practice in the Southeast that has 3D micro-ultrasound MRI fusion biopsy machines through a company called ExactView. We are also the first practice in the country to offer outpatient robotic surgery outside of the hospital. We involve and utilize advanced technologies in the clinic, including state-of-the-art endoscopy that we can do in the clinic and in the surgery center. We have the most advanced laser machines for kidney stones. We are always pushing the envelope, and we are always being approached by the leaders in the field of urology to use their technology and provide feedback and testing. And I think that that makes us one of the few practices in the country always on the forefront of technology. And that is immensely huge, specifically in urology, when we're dealing with people's issues with urination, with kidney stones, with cancer, the whole gamut. The work culture at Advanced Urology is by far one of the most things that we are proud of. We were named an AJC Top Workplace for 2 years running. Our staff are always engaged. We have weekly employee appreciation programs. The one thing you'll ask, if you ask any of our employees what they feel about our practice, is that we have heart, that we're family, and then that matters the most. Everyone comes to work extremely happy. We all hang out outside of work and in work and joke around, and the days go by so quickly because everyone is always having such a great time here. Many people may be afraid to go see their physician during these interesting times with COVID-19, but just know that we are taking every precaution possible to make sure that the healthcare facility is the most safest place that you can go. We do not take COVID-19 lightly, as you know that we don't, and we do everything that we can to make sure that our patients are safe and taken care of for. At the end of the day, we all still have health issues. We still need to get them taken care of. And COVID-19 should not stop us from making sure that we provide you a great quality experience with a great outcome without any additional risk of COVID. That's why all of our facilities have COVID screeners outside in the front, making sure that patients are safe from other patients and from our staff, to make sure that our staff and our patients are healthy so that we continue to serve you. Our surgery centers are all top of the line. They do not have, we have not had any cases of COVID-19 come through our centers. That's due to the major efforts that we take to screen patients, make sure that we have good hand washing, we wear masks, all the things that you would expect us to do. And that allows us to take care of our patients outside of the hospital setting. One thing about advanced urology is that we are our own mini health system. We offer in-house laboratory, in-house imaging, and in-house surgery at all of our centers to make it convenient for the patient to get all of their work done in one single location without having to navigate insurances, different locations, different surgeons, different payments. We make it very easy and straightforward for you to get your care done in a facility that's safe, clean, and COVID-free. My final thoughts in regards to advanced urology is that there's no better urologic practice in the Southeast. We take our patients' concerns seriously. We are always trying to provide a great experience. We lose sleep sometimes trying to make sure that we are doing the right thing for our patients and that they are having as good of an outcome as possible. And we just want to continue providing that service to our patients in our community and to the greater good of urologic care. We offer same-day appointments. We even do same-day surgery. If you have patients or you're in trouble and you need to be taken care of that day, we can usually try and make it happen. And most importantly, we take all insurances. There should be no barriers to getting between you and great care. And that's why here at Advanced Urology, we do everything we can to make sure that we are accessible to you. If you want to make an appointment, please call 678-949-5086. That's 678-949-5086. Thank you.
Grab your friends or make it a date night in the comfort of your own home and join us this October for Good Taste Gwinnett. This year's event will be a virtual cooking showcase featuring local restaurant chefs whipping up their signature dishes and sharing their secret cooking tips. Watch for free each week and go to goodtastegwinnett.com for tickets and information. Special purchase of a VIP or chef's ticket receives a free goodie bag. Just make sure you don't leave any food lying around once you're done. Join us for Good Taste Gwinnett, powered by Jackson EMC.
Now I'd like to introduce William Dennison, founder of Dennison Hearing Solutions. Will is nationally board certified in the hearing instrument sciences, along with holding a Bachelor of Science and Master of Arts from Georgia College and State University. Dennison is also the only tinnitus care provider certified by the International Hearing Society in the state of Georgia. Please welcome Will Dennison.
Thank you, Will. This is Will Dennison with Dennison Hearing Solutions. For most people, hearing loss is not an inability to hear as much as an inability to understand. You hear someone talking, but it may come across as muffled or mumbled. You might hear the beginning of a sentence, but lose the end of it. You might think people are speaking too fast or not speaking clearly enough. These are all indicators that something might be going on with your hearing. When sound hits our eardrum, it goes through a process and eventually ends up moving millions of hair-like cells in our cochlea, which then transmit signal to our brain. Over time, these cells become worn out from use, and it takes a louder stimulus to excite them. Imagine walking from the front door to the mailbox each day. Over time, you eventually wear a path through the grass. This is what happens as sound passes over those cells, and why the more birthdays we get, the more likely we are to have some difficulty with our hearing. In fact, by the age of 65, a third of the population has some level of hearing loss. Too often, I hear patients say they hear fine for their age. When we choose to ignore our hearing loss or just accept it without treatment, we're not only doing a disservice to ourselves, but to our loved ones as well. Untreated hearing loss does damage to our brains and to our relationships, which is why I tell each of my patients that hearing health is whole health. You cannot live a completely healthy life and ignore difficulty with your hearing. Today, I want to take a few minutes to discuss one example of how hearing can impact other areas of our health, specifically our cognitive health. When we hear, our brains are taking different sounds and putting them together in a way that makes sense, kind of like putting together a jigsaw puzzle. As we begin to lose our hearing, some of those puzzle pieces are being taken away from us. You might hear part of a word, but you have to guess at the rest of it. Context and visual cues can help with this, but it's still a guessing game. Did they say yoga or yogurt? Pearl or girl? This guessing game puts additional stress on our brain that can impact us in many ways. For one, this can lead to cognitive overload. If your brain is working harder to understand what's being said, it does not have as many resources available for processing or remembering. It can be an exhausting exercise trying to follow a conversation when you have a hearing loss. In fact, many of my patients have reported that they have more energy at the end of the day after they begin wearing hearing aids for the first time. This is just one way that hearing impacts our overall well-being, and why doctors recommend anyone over the age of 55 incorporate a hearing checkup into their annual wellness plans. So when was your last hearing checkup? Dennison Hearing Solutions offers the most comprehensive evaluation and consultation around, and it's one of the reasons we have been voted Best in Gwinnett each year that we've been open. Our complete evaluation is usually $125. However, for everyone attending the Generations Expo, we are going to offer you the full evaluation at no charge. But please call today, because this offer will expire at the end of the month and space is limited. Also, we are following CDC guidelines to ensure a safe environment for you at the time of your visit.
Cameras. Rolling. Rolling. Middle 17, take 7, action.
Now here's a song of mine that Reba McEntire almost recorded. It's called Pieces of My Heart. How many pieces of my heart did I give to you?
Okay, Mama.
How many times can I cut you back
All right, I'll tell you.
and not call myself a fool?
What? Where? The beauty for you? Oh, no, don't.
How many pieces of my heart did I give to you?
Now, Lombardo, stop. Because I know if I even try.
This year has been tough on all of us. Your loved ones in your household have been more important than ever. Sometimes the simple things and an easier pace of life provides us with perspective on our values. Time with our family, meals together, moments well spent with the ones we love.
I'm asking you to join me in being a team player for a healthier Gwinnett. As a team, we can stop the spread of COVID-19.
Welcome back to the second edition of the Generations Expo virtual event, sponsored by Northeast Georgia Health System. I'm Will Hammock with the Gwinnett Daily Post. Our next guest is from the recently opened Royal Blue Medical Center office in Lawrenceville. Welcome, nurse practitioner Laquan James.
So here at Royal Blue, you will be greeted with a smile, great people, and you can tell as soon as you come in that we have the type of energy that you would feel comfortable in, the type of energy that you would feel safe. And so if you're at home right now battling any of these symptoms that I previously noted about hormones, as in depression, anxiety, arthritic pain, insomnia, heart flashes, those types of things, or at home with nagging knee pain, nagging pain at all, I promise you that we have something here that can treat that. Whether it's hyaluronic acid, PRP, or doing hormones, we have an answer to your question. So just give us a call or come into the office, and I promise you, you will feel better when you leave.
Hello everyone, my name is Dr. James Rowe and I'm the clinical director here at Royal Blue Medical Center. And my function basically is to make sure that everyone on my staff has things that they need, from our nurse practitioner to our medical assistant to our office manager and anybody else that runs and does procedures in this facility. Making sure that they have their tools, making sure that things are ordered for them, and just that their jobs are made much easier because I'm doing a lot of the back end stuff for them. Really happy that to be here at Royal Blue. It's been a great experience. I believe in what we're doing. You're going to hear a lot and have probably already heard a lot about what we do via procedures here. We're excited to be here in Lawrenceville. This is our place. This is where we never really want more than 4 people waiting in this area because one, we can social distance if we do that, okay? So that's great. They can watch the video. Then you come into this area. This area is eventually going to be a PT area where we'll have 2 PT tables here, 1 chair in the middle where the therapist can work on this person and on this person at the same time. We also will have like another chair here, the one that's in that room, where people who may just be coming in to get their injectable shot, which takes 5 minutes, we'll already know the schedule, they'll sit right here, wait. They'll be called into this room right here, they'll get the shot, and then they're out the door, pay and go out the door. This is our orthoscan machine, which is right here, and that is bread and butter and the piece of equipment that allows us to really stand out above any other practice that's doing injections into the knee or shoulder, because we can do it with pinpoint accuracy, because it does show us an actual visual in time of the joint when we put it up on that screen, and the patient also can see that as well. They're injected here as they're sitting in this chair. Quan is able to do that again with the dye. Then he puts in whatever substance that he's going to be using, whether it's hyaluronic acid or whether it's going to be the PRP or some type of regenerative procedure that he's going to do as well. Okay? This is the area of our facility where we would spin, or what we call centrifuge, the PRP. We would put it into this tube here. We spin it for a lot of 8 minutes of time or whatever it is being required for that procedure. We wait, we let it sit. Okay, then we come back, we load it into the syringe, and then we do the injection. But all this equipment is here for that purpose, okay? This is where we will do all our blood draws. So we want to keep everything in regards to injections with blood. We want to keep them back on this side of the building for universal precautions as well. So we can go from room to room here. Patient's blood is drawn here. Then it's just a quick step back over to where I just showed you into our centrifuge room, where we would spin the blood in the centrifuge. This will also eventually be a PT room as well. Currently I have my chiropractic tables in here. I do still see some chiropractic patients. That is a part of all the holistic picture of care that we do here. If patients request that, then we certainly offer that service to them as well. But we also encourage it depending if they have particular joint pains, especially in the low back and or neck as well. These 2 offices here are just examinations room. This is where pelleting is done. So when someone gets an HRT pelleting procedure, they would go into this room here. This is where most of the injectables, where the people who just come in each week to get their injection shot, they come in and out the door. We've already done the exam, done their blood work. We know what their dosage is, and we know what schedule we have them on, okay? Then if you come over here, the first thing that we like to do when we have someone come in as a patient, I'll do a consult, I'll look at their paperwork, I'll talk with them a little bit about what we're seeing. If we've already drawn the blood, the lab work would be back. I want to get basic vitals. So you'll see here we have our SPIG, our blood pressure cuff, our heart rate monitor, everything is here. The patient is here, we get their weight, and we get all that into the file also, because that's very important to get their basic vitals. This is where we store. This is where we can store our controlled substances in this cabinet. It's our pellets. Our autoclave is how we clean our instruments after we do procedures. So it's there on this table, so that's what this room is here for. This is our wonderful nurse practitioner, Quan James, who you just heard for, busy at work already. And his office is adjoined to mine, which is here. And so this is our space. We look forward to seeing you and helping you in any way that we can. Thank you.
Thanks so much. Welcome back. According to the CDC, about 140,000 Americans die each year from strokes. Did you know that the nation's highest death rates from stroke are in the southeastern United States? Do you know the signs of a stroke? Our next guest, Tina Johnson, stroke coordinator at Northeast Georgia Medical Center, Barrow, will share important information about identifying the early signs of a stroke.
We're speaking with you today about May being Stroke Awareness Month in the United States. Stroke occurs approximately every 40 seconds in the United States, and this equates to about 795,000 stroke patients per year. Unfortunately, 140,000 of those patients will also die from their stroke. Northeast Georgia Health System would like to make sure that everyone understands the signs and symptoms of a stroke and understands the need to activate 911 emergency services if they see these symptoms. One of the acronyms that we use is called B FAST. With this acronym, B stands for an acute loss of balance. You're no longer able to stand up appropriately. When you look at the E, that stands for eyes, and that means that you've had a loss of vision or maybe a sudden onset of blurred vision.
F stands for face, any sudden onset of facial drooping or numbness. A stands for arms, any sudden onset of arm weakness or numbness. S stands for speech, any sudden onset of difficulty speaking, such as slurring your words, not being able to speak, or simply hard to understand. T stands for time. It's time to call 911. If you have these symptoms or recognize them in someone else, it's time to call 911 immediately, even if the symptoms improve.
By using Be Fast, you can help ensure rapid stroke treatment. When it comes to stroke, every second counts, and rapid treatment can help improve survival and reduce the disability after stroke. Our emergency departments and inpatient stroke units stand ready to provide stroke care every single day, no matter what the world looks like. During this pandemic, we want you to know you are safe coming to Northeast Georgia Medical Center for stroke care. We are prepared to take care of you and your family when you need us.
Thank you for joining us today for Generations Expo virtual event presented by Northeast Georgia Health System. You can view this event in its entirety or watch areas that are of interest to you starting tomorrow at GwinnettDailyPost.com and over the next few months on GenerationsExpo.com. Thanks again to our presenting sponsor, Northeast Georgia Health Systems, as well as our supporting sponsors and preferred vendors, including Dennison Hearing Solutions, Royal Blue Medical, Fernbank Museum of Natural History, the City of Lawrenceville, Gwinnett County, Love & Florist, Advanced Urology, Aurora Theater, Belk Mall of Georgia, and the Gwinnett Stripers. Watch for door prize winner announcements at the end of this event. You could be the winner.
NGMC is committed to caring for all patients, regardless of their ability to pay, so they don't have to leave our community to find care. Just last year, we provided more than $40 million in financial assistance to those in need. Choose community. Choose NGMC.
Grab your friends or make it a date night in the comfort of your own home and join us this October for Good Taste Gwinnett. This year's event will be a virtual cooking showcase featuring local restaurant chefs whipping up their signature dishes and sharing their secret cooking tips. Watch for free each week and go to goodtastegwinnett.com for tickets and information. Special purchase of a VIP or chef's ticket receives a free goodie bag. Just make sure you don't leave any food lying around once you're done. Join us for Good Taste Gwinnett, powered by Jackson EMC.